What are some of the biggest fertility red flags that you don't know about? Let's talk about them. There are lots of known reasons for infertility: PCOS, endometriosis, blocked tubes, no sperm, old eggs. But underneath that, if we look at the root problems, there are about 50 subclinical factors that are clearly defined in the medical literature that significantly reduce your likelihood of getting and staying pregnant. I'm not going to go over each and every one of them. I will talk about some of the most important ones that you should start thinking about, because knowing what your underlying factors are allows us to create a roadmap to work on specifically what you need, not just in general what improves fertility, because usually this is a waste of time, money, and resources. First, energy levels. What's your energy like on a 1 to 10 without caffeine or exercise? Your embryonic cells, your egg cells, they contain 10 times more mitochondria than any other cell in the body. Why is this? Well, because when the sperm and the egg come together, they have to start multiplying like crazy. This is what we're looking for with HCG. Is that HCG doubling every 48 hours? Guess what? That takes energy. And we know that fatigue is correlated with infertility and highly correlated with miscarriage. Next, let's talk about your menstrual blood. Your menstrual blood is basically a monthly reminder of how good your lining is going to be. So what we found to be the optimal amount is 4 days of bleeding. Soak a tampon or a pad every 4 hours. Cramping, no clotting, no spotting, fresh red blood. In our clinical practice of over 20 years with more than 10,000 patients, this was the lining in which we had the highest success rate in IVF cycles, which means they were implanting and staying. And last, but certainly not least, are your temperatures after ovulation. Now, this is something that we developed in our clinic, having looked at thousands and thousands of basal body temperatures, cross-referenced against the people who were having miscarriages. And we found that the majority of women who had recurrent pregnancy loss did not get temperatures above 98 consistently across the across the luteal phase. We also found that when women's temperatures were consistently above 98, they had great progesterone levels, and we need this in order to stay pregnant. How do you fix all this? It's a little bit complicated, because then we have to go in and figure out what are the underlying factors causing those problems, and if there are underlying factors, how those are causing problems, and then tie them all together and make a plan. If you want help doing this, the new conceivable app, Kirsten AI, my digital twin, $15 a month, will do all of this for you, custom menu plan for you, tell you what supplements to take, support you emotionally, and give you so many more resources. Check it out at conceivable.com and let me know your thoughts. You can sign up for early access and you'll get it half off, so do that today.